We begin with news of another big jump in COVID-19 cases today on the Big Island. 45 new cases, the highest the county has seen since the beginning of the pandemic.
And while many of the cases are part of known clusters, there is a growing amount of community spread. Kimberly Speakman has more.
The Department of Health tells me they're seeing an increase in cases in the Hilo and Kailua-Kona areas. But testing will be key to finding out where the hotspots are and controlling it.
Out of the 45 new cases reported, 16 are from the Hilo Life Care Center, 2 are from the University of the Nations, and 27 new cases aren't associated with those clusters.
There is evidence of community transmission in many parts of the island right now, though there may be very defined clusters at this time. Our investigation may find more, may find additional pockets.
We're monitoring the situation very closely on Hawaii Island. We are concerned about the increase in cases.
Hilton Rathel with the Healthcare Association of Hawaii says right now hospitals on the Big Island are doing okay in terms of capacity, but that could change in the next 2 weeks. He says they have staff in place just in case.
We have some additional staff on Hawaii Island right now as a result of the contract that we got some funding from the governor for CARES Act funding, and there are 9 additional staff.
Hilo Medical Center says they're on alert as well.
As the largest hospital on the Big Island, we have an obligation to our community to be at the ready. Just in the last 2 days, we had quite a large shipment of PPE come in.
But they're asking people to do their part to stay safe.
It's everyone's individual responsibility to make sure they're doing what's right so we can keep that number low, so we can make sure that it doesn't have a huge impact on our hospital.
Another major part of controlling the COVID spread is testing, which will be taking place on the weekend.
We are really beefing up our testing because that's the key to everything. The purpose of the testing was to spot who is positive, and we'll continue this throughout the island and identify the cluster areas.
Kimberly Speakman, KHON2 News, working for Hawaii.